Assalamualaikum warahmatullahi ta'ala wabarakatuh. A pleasant morning to each and everyone. So our topic is all about substance-related addictive and impulse control disorder. And my part is the continuation of report of Miss Bello. So first of all, we all know if the person continues substance or different substance, it has a harmful effect or consequences in our body or relationship to others and many more. So, first is other drug abuse. A number of substances are used by individuals. So, sometimes we are not aware or mismong tayo is nakakagamit pala ng other drug abuse. Minsan nahahawakan pa natin or minsan meron pa tayo sa bahay. This drug do not fit neatly into classes of substance we just described but are nonetheless of great concern because they can be physically damaging to those inject them. So, sinasabi dito, these other drugs ay hindi pa klaro or if hindi pa talaga belong sa substance. Kasi nga, describe lang natin or dinidescribe lang natin na substance kasi nga nakaka-damage siya sa physically or mentally. Kaya nga sinasabi natin na other drug abuse. So we briefly describe inhalants, steroids, and many more. So inhalants include a variety of substance found it. So if you ask what is inhalants, it is a substance that people inhale or breathe in to get high. Some common inhalants that are used is spray paint, hairspray, paint thinner, gasoline, and many more. So, di ba, a while ago, sinabi ko na hindi tayo aware na mismong tayo is nakakagamit or nalalanghap natin itong other drug abuse. So, meron siyang mga effects sa ating katawan. So, nandito na yun if araw-araw mong naaamoy, pwede kang magkaroon ng or ma-experience itong anxiety, depression, or many more. So, next is withdrawal delirium. So, withdrawal delirium, this is some severe form of withdrawal and typically seen in a alcohol withdrawal. So, this withdrawal delirium commonly or typically seen sa mga taong very dependent sa alcohol, then suddenly they stop drinking. So, kung iisipin natin, it is very sad for some reason if they stop drinking or paunti-unti na lang, saka pa nila to ma-experience or ma-feel sa kanilang katawan. The condition can be produced frightening, hallucination, or experience illusion. So, if the person experience with withdrawal delirium can feel na takot kahit walang rason, and sometimes they hallucinating things or nagkakaroon sila ng mga guni-guni sa paligid. And last, they do parang gumagawa sila ng mga sariling mundo or nagkakaroon sila ng illusion. So next is, the onset is usually within a week or stopping or reducing alcohol. So kapag nag-stop ka na uminom, hindi ibig sabihin bukas na bukas is magkakaroon ka ng withdrawal delirium. It is, umaabot siya ng 1 week or more than doon. Then mafe-feel mo na meron kang withdrawal delirium. Next is, it causes sudden and severe problems in your brain and nervous system. So, syempre, if you drink daily or dependent ka na sa alcohol, your body kapag dependent ka na sa alcohol, syempre, yung brain natin is parang magkakaroon ng, hindi naman damage, pero naapektuhan siya, and also your nervous system. So, hindi na masyado silang nagpa-function because alcohol dependent ka na. So, always remember, withdrawal delirium only affects those people have history of heavy alcohol. So, these are the symptoms. Meron siyang mga symptoms. So, the first is nagkakaroon ka ng anxiety, chest pain, sweating, irritable, and fever and fatigue, and etc. So, next is Wernicke-Korsakoff syndrome. So, hindi ko alam kung tama yung enunciation ko, pero Ito na talaga. Wernicke-Korsakoff syndrome, a brain syndrome resulting from prolonged heavy alcohol. So, di ba? So, when you drink always, the alcohol kasi suppress certain neurotransmitter in your body. That's the reason na if you drink always, you feel relaxed kapag umiinom ka. So, it is believed that it is believed to be caused by deficiency of thiamine, vitamin B1, or poorly by heavy drinking. So, the reason nga, if kulang ka sa thiamine or vitamin B1 is, ito na yung umaatake itong Wernicke-Korsakoff syndrome. So, ang commonly, ang Wernicke-Korsakoff syndrome happen sa mga taong dependence din sa alcohol, or I should say, yung may alcohol use disorder, and to those person na malnutrition. Kasi nga kapag alcohol dependent ka pa, also malnutrition, umaatake na itong Wernicke-Korsakoff syndrome. So, ano nga ba itong mga effect? Meron siyang, anong mga epekto sa ating katawan? So, first is, meron kang loose memory, and nagkakaroon ka ng liver disease, also nagkakaroon ng cardiovascular. So, ang mga symptoms nito is confusion, pagkalito, hindi mo alam kung ano-ano ba, and also visual changes. So, yung visual changes mo is parang hindi na siya, yung mga eye movement mo is hirap ka ng maka-focus sa yung kapaligiran, kung ano ba yung mga nakikita mo. So, meron ako nakitang video na sa sobrang dependent niya sa alcohol is nakakalimutan niya na yung birthday ng asawa niya, kung kailan siya pinanganak, or hindi niya nga alam kung ano ba yung mga memories niya na nangyari sa buhay niya. I saw this video sa YouTube. That's the reason na kapag meron kang Wernicke-Korsakoff syndromes is yung brain natin is ang hirap ng mag-function. Kasi nga yung neurotransmitter natin is nagsusuppress. That's the reason na kailangan natin mag-ingat sa ating ginagawa. So, if you are alcohol dependent, paunti-unti na lang, or mas mabuting mag-stop ka na lang. So, next is fatal alcohol syndrome. So, condition in a child that result from alcohol exposure during the mother pregnancy. So, if the mother is exposed sa alcohol, possible is magkakaroon siya ng fetal alcohol syndrome. So, we all know, di ba, kapag buntis ka is dapat maingat ka sa pagkain. Kasi nga, if you eat a lot or hindi mo alam kung ano ba yung dapat mong kainin is pwedeng makaapekto sa yung kalusugan, or also especially sa baby. So, di ba, it very, very, kapag buntis ka, dapat maging maingat ka sa lahat ng bagay. Dapat maging prudent ka sa lahat ng yung ginagawa, even sa yung pagkain. So, fetal alcohol syndrome causes brain damage and growth problems. So, probably, the baby ay na-aapektuhan. Like, yung brain damage and growth problems. So, sa brain damage is yung bata ay nakaka-experience ng mga ganito, like, difficulty in reasoning, poor memory, and poor coordination. Yun yung pwede ngang ma-experience kapag lumaki na siya, or kapag yung nanay is may fetal alcohol syndrome. Also, sa physical naman is nakikita natin yung bata na maliit ang mata, yung nose naman is iba sa atin, also yung head is maliit, and then yung vision and hearing niya is hindi gaanon parang hindi nagfa-function, or kumbaga yung vision niya is malabo, and also yung hearing niya is hindi masyado makarinig. So, then sa social naman is pwede niyang ma-feel or ma-experience is yung ang hirap niya makipag-socialize to others, and then ang hirap niya makabuo or poor concept of time. Yun yung pwede niyang maranasan if the mother is merong fetal alcohol syndrome. So, the next is benzodiazepine, class of drugs that can treat rage condition. So, doctors often prescribe them to treat anxiety, seizures, and insomnia. Originally touted as a miracle cure for the anxieties of living in our highly pressure technology society. So, very naiintindihan naman natin na this drug is pwede siyang makahelp to those people na can experience anxiety, insomnia, and however is itong gamot nito is dapat prescribed by doctors for some reason in short term is pwedeng effective. However, kapag naman long term, it leads to tolerance. So, always remember, taking too much can be dangerous to your body. So, ano-ano nga ba yung mga side effects? So, drowsy, confusion, dizziness, and depression. So, more serious effect is memory problems, behavioral changes. So, ano nga ba yung best disadvantage ng gamot na to? So, kanina a while ago, sinabi ko yung advantage is nakaka-cure siya ng insomnia and anxiety. However, pwede siyang mag-lead sa masama. Like, kasi nga itong gamot is walang amoy. That's the reason na nabasa ko sa DSM-5, pwede itong magamit sa mga, kapag yung mga lalaki is gustong mang-rape, pwede nilang ihalo ito sa inumin ng mga babae, kaya tulog na tulog yung babae. That's the reason na makakagawa sila ng hindi maganda. So, next is amphetamines. Amphetamines are drugs that can be illegal or illegal. They are legal by they prescribed by doctors. Amphetamines are illegal when they are used without prescription, can induce feeling of elevation and vigor, and can reduce fatigue. So, yes, amphetamines is a drugs. However, kapag ginamit natin siya is dapat prescribed by doctors kasi nga pwede siyang maging illegal to those people na walang prescribed by doctors. Kaya very important if you use or take it, kailangan may prescription siya ng doctor kasi nga when you try it, you are very high or energetic na nakakaalis ng pagod, parang gusto mo na lang na uminom kasi nga yung stress mo or yung pagod mo sa katawan is re-reduce. That's the reason na may mga tao na nagta-take nito para naman hindi nila ma-feel yung pagod, hindi nila ma-feel na stress sila. So, syempre, if dependent ka na sa mga drugs na to, is pwedeng magkaroon ng side effects. So, the first is, yes, anxiety, bladder pain, crying, delusion, and visual sense, mental depression. So, yun yung mga side effect niya sa ating katawan. So, always remember nga kasi nga, if your body is dependent, is hirap na tayong mag-stop. Kaya nga kailangan natin is, kapag uminom ka ng gamot, uminom ka ng drug, is prescribed by doctors, di ba? May mga prescription ng doctor na ganito lang dapat. That's the reason na kailangan nating sundin yung mga dapat nating inumin. So, next is tobacco-related disorder. Tobacco-related disorder means you are addicted to tobacco. You are trouble stopping using tobacco. It contains the drug nicotine. So, if you are tobacco-related disorder, is ang hirap mo nang mag-stop. Kasi nga, yung tobacco is meron siyang nicotine. So, ano ba yung nicotine? Nicotine is addictive because it gives a quick boost to your moods. Diba? Pansinin nyo, if yung tao is nakadependent or meron na siyang tobacco-related disorder, is kapag hindi siya nakakasigarilyo, is parang very moody siya, wala siya sa mood, kasi nga, yung katawan niya is hinahanap yung, pero once na high siya, nakakagamit siya, is very energetic. That's the reason na parang yung katawan niya mismo yung nagsasabi na don't stop kasi hinahanap-hanap na ng katawan niya. So, syempre, meron siyang side effects. So, alam naman natin kapag yung tao is tobacco-related disorder, meron siyang lung cancer, pwede siya magkaroon ng lung cancer, heart disease, stroke diabetes. So, very, very common na itong sa atin dito mga side effect niya sa ating katawan. So, next is caffeine use disorder. Caffeine is the most psychoactive substance called the gentle stimulant because it is thought to be the least harmful of all addictive drugs. However, caffeine can still lead to problems similar to other drugs. These drugs found in tea, coffee, soda drinks, and cocoa powder. So, kasi nga akala natin ang caffeine use disorder is nasasabi na gentle stimulants pero we do not know na para din siyang other drugs. Nakaka-apekto pa rin sa ating katawan if addict na tayo. Kasi nga, saan ba natin nakukuha itong caffeine? So, nakikita siya sa mga tea, cocoa, soda, drinks, and cocoa powder. Have you noticed na if the person is pagod na pagod, kapag uminom lang sila ng coffee, parang nararelax yung katawan niya, parang nais yung pagod nila kasi nga meron sa coffee na yon, merong caffeine. Also, yung mga taong gustong mag-focus sa study or mag-study, umiinom sila ng mga soda drinks kasi nga sa soda is very high yung caffeine. That's the reason na very active yung brain nila, also nakaka-focus sila. But they do not know na akala nila is good kasi nga na-focus sila, pero it's not kasi nga may caffeine. So, ano nga yung mga epekto nito? Meron siyang increased energy. So, a while ago sinabi ko na once you are taking a coffee, soda, syempre na-energize tayo. So, and also nakaka-concentrate tayo. Ano yung mga side effects? Syempre, if the person always drinking a coffee, nagkakaroon siya ng insomnia. Ang hirap niyang makatulog sa gabi. And also, increase heart rate. Sabi nga nila, if you always taking a coffee, nagpapalpitate yung puso natin. Yes, it is true. Kaya nga, if you are addict in coffee, minimize na lang kasi nga, it's not good for our health. So, last is opioid-related disorder. Opiate refers to the natural chemical in the opium poppy that have narcotic effect. Chronic brain disease characterized by continuing opioid use despite harmful consequences can relieve pain, induce euphoria, and impact mood. So, kasi nga itong opioid-related disorder is nakikita siya sa flour, which is yung flour is ginagawa naman siyang seasoning, ginagawang different ingredients na ginagamit sa different, or pwede natin sabihin sa foods, sa coffee, sa seasoning. Then, hindi natin namamalayan or hindi natin alam na nakakasira na to na siya ng brain disease. So, also, nakaka-relieve siya ng pains in some sa ating katawan, in some parts of our body. But they do not know na, yes, nakakasama sa ating katawan. So, ano nga yung health impact? So, drowsiness, insomnia, and ito pa yung malala. If you are not stopping taking this opioid-related disorder, is pwede kang magkaroon ng coma. So, always remember guys na taking too much drugs is pwedeng makasama sa ating katawan. Diba? Sabi nila, yung teacher ko ng grade 10, sabi niya, if masakit yung ulo ninyo, if may masakit sa inyo, baka kulang lang kayo sa water, kulang lang kayo sa exercise, huwag masyado kayong uminom ng gamot. Kasi nga, hindi natin alam, yung different drugs is may mga epekto. Yes, nakakais ng pain, nakakais ng ganito, but meron siyang side effect. So, kailangan natin maging prudent, kailangan nating maging parang aware sa lahat ng ating tinitake kasi nga pwede siyang maka-apekto sa ating katawan. So, that will be all. So, sana may naintindihan kayo sa aking part. So, again, I'm Baysori Ibandali. So, currently taking a Bachelor of Science in Psychology. So, thank you!